Welcome back to another episode of the Last Zebra podcast. I'm your host, Ugo Ezama. As always, please don't forget to like, subscribe, share, and comment. Today we have our guest, Dr. Amber Hardman Milson.
Yes.
Welcome to the show.
Thank you. Thanks for having me.
I appreciate you making it out on this humid afternoon here in New Orleans.
Yeah, it's just another day.
Just another day in New Orleans.
Yeah.
Tell us a little bit about yourself.
Yeah, so I've actually been in New Orleans for a while. I ended up doing med school here. But to kind of go back, I grew up all over. I was born in California. I lived in different countries like Japan, traveled to Australia, all these places with my family because my mom was in the Navy, my dad also, but we traveled with her. Most of my adolescent years, I played golf. So golf took me to college. I played at Dartmouth, and then I transferred to Vanderbilt. After Vanderbilt, I was kind of trying to figure out, do I want to play golf? Do I want to do medicine? So I went to UAB, and I did an MPH while I also ran a golf course and taught golf lessons there. By the end of that, I was like, I want to do medicine. So that's what brought me to Tulane to do. I actually did an MD MBA here because I knew all the public health background, but I also, based off of what I knew I wanted to do in the future, I wanted to have the business knowledge and background too. So I've kind of stayed in New Orleans. I took a slight hiatus going to Mississippi for a year. I started out general surgery residency, decided I wanted to kind of pivot my career goals, switch to med peds, and now I'm going to be an allergist immunologist.
That's amazing. That's a very, very succinct biography. But there's a lot in there.
There's a lot in there, a lot of change.
Oh my goodness. So you were born in California.
Yeah, San Diego.
Where's the place that you lived the longest?
Probably Dallas.
Really?
So we lived in Dallas and then we left. We would kind of go back and forth between other places, but I was consistently in Texas from 5th grade to 12th grade. So gotcha. That was the longest.
And you've been, well, you mentioned Japan. Japan keeps coming up on the show. We've had a few friends of the show, if I can say that have either by work or by pleasure been to Japan.
Yeah. No, I loved living in Japan. I was there from like 1st to 3rd grade. We lived on one of the military bases that's a little bit outside of Tokyo. Mm-hmm.
Do you speak any other languages?
I speak Spanish.
Fluently?
I
did not know that.
Yeah. I, at one point in my life, knew a little bit of Japanese, and I was really, really good at Japanese math on the abacus. They call it soroban. So I would do like mathlete competitions and I would beat all the older kids. But yeah, the only language that I fluently speak other than English is Spanish. How
did you get Spanish? Was that through the traveling of the family or by your own?
No, so part of it was just like my own interest in the culture. Like I said, spending a lot of my time in Texas, there's a lot of different Hispanic populations, like primarily Mexican, but there's people from like Honduras, El Salvador, etc. So one of my majors in college was Spanish, and I ended up writing a Spanish thesis, and they let me do like Vanderbilt in Spain so I could study at the libraries there. So I could get books in the Spanish language.
That's amazing.
And so after that, I did some like medical missions in Guatemala and Costa Rica. And then even now that I'm a physician, I would say at least half my patient panel is Spanish speaking only.
That's it. Wow. So you kind of did it by, obviously through the academic route, but then you certainly had some exposure through immersion. So
Right.
You had all this exposure either at home or when you did your missions.
Right, exactly. And when I was in Spain, it was Spanish only. I lived at a host. I had a host mom, and so she knew no English whatsoever. And when we were in classes, we weren't allowed to speak any English either. So.
And this was through Vanderbilt? Mm-hmm. How long were you there for?
I was there for a summer.
Wow.
Yeah.
Wow. And golf.
Yeah. I did a lot with golf. I actually still do some things in conjunction with like the PGA Tour and the program that I grew through, which is called First Tee.
How did you start? How did you start in
My
golf?
dad. Yeah, my dad was a very avid golfer. He actually had wanted to do the senior tour, but then when we moved overseas, he decided to stay home and take care of me and my sister while my mom was out on ships with the Navy. And he taught my sister and I both to play golf, and she played through high school, and then I kept going.
Do you still play every once in a
I
while?
really want to. Like, I know like med school and residency have kind of dampened my financial and time ability.
That's fair.
For now.
That's fair.
But now that I'm coming out of that, I was actually just talking to somebody today about how I want to get back out on the golf course. So I hope so.
When's the last time you played?
I played actually with my dad in Houston. He's a member of a club that's right behind our house. So anytime I go back to Houston, I try to play with him. So that was maybe like a month or so ago.
That's curious because I think, and this is probably my ignorance, you would be the only black girl that I know that plays golf.
Yeah, there aren't very many of us.
Off the top of my head, yeah.
Yeah, when I was like a very high level competitive player, I can think of like 3 or 4, and one of them was Cheyenne Woods, who's Tiger Woods' niece. So like I was playing in tournaments with her. And then I had another friend, her name was Gabrielle, and then there were like 1 or 2 other, we were all very spread apart in the US, but we would all see each other
Wow.
at the different tournaments. Yeah. So it still hasn't spread as much through the African-American community in general, not just women. But I think I know one of the goals of First Tee, the program that I played through, is to help expose people of all like background, socioeconomic statuses, et cetera, to golf. So it's expanding.
How did that coincide with school in general? Because I think about how athletics and school, especially when you're growing up here, it's not really, there's school there's the athletics that you do in school, and then it kind of bleeds into your everyday life where you have travel ball for different kind of sports. How does that translate with golf?
So it actually worked out really well for me. I went to a private all-girls boarding school.
You went to boarding school?
It was in Dallas, but there were day and boarding students. And the goal of that school is to make sure that every girl reaches her fullest potential, regardless of what that is. So we had many girls who were like very good in like STEM and sciences. We had some really great like singers, theater girls. There were a lot of high level athletes. Like I had an Olympic swimmer in my class. I had an All-American lacrosse player in my class. So we were able to have a little bit more flexibility with our schedule. I played in it was called the North Texas Junior PGA and some of the other Junior PGA tournaments. And I was able to travel around, but still get my schoolwork done. So they would give us everything that we needed to ensure that we stayed on par with everything. Right. But then I also played for the school team all 4 years. We went to like conference championships all 4 years. I did all of the things, so both inside and outside of school.
What are the heights? What heights did you get to in golf? I think PGA Tour. I think that's the highest.
Yeah, so I played in some pro-am tournaments through like the First Tee program, and then I played in junior PGA.
That's amazing. That is really, really cool. How did you then pivot to medicine? Do you have family members in medicine?
I do. So I actually am exposed very well to physicians, not just people in the medical field. I have a number of family members who are doctors, from like OB-GYN to family medicine to my brother-in-law is anesthesia. My sister-in-law is emergency medicine. We have a rad-onc, just a lot of physicians in my family. But I always knew that I wanted to do medicine. I wasn't exactly sure if it was like a doctor or in some other capacity, but I knew that I wanted to help people help themselves. So I know a lot of people are like, oh, like I really want to just help others, but I really wanted that extra component of not just helping them, but like helping them do something that would improve their life in some way, which is actually part of why I did golf coaching and mostly for children, because there are a lot of metaphors between like golf and life. And I felt like I was able to not just teach them the sport, but like, oh, not everything's going to go your way. Or like when you get mad, how do we handle that? Or like when something good happens, how do we handle that? And I was able to transfer that to like the clinical setting. So like I said, that's kind of how I decided, I really enjoy golf. I really like teaching. I like being on the golf course, but I felt like there was a little bit more that I could do. I wasn't exactly sure what type of doctor I wanted to be. I think I started out wanting to be like a pediatric hematologist or something. But once I got more exposure, I've kind of gone through a variety of specialties to get to where I am now.
I heard a Cat Williams quote the other day, because I did not know until yesterday. I saw this yesterday. It was on one of the posts on social media. I think it was on Twitter. And he was describing golf, and I'm paraphrasing. He was basically saying that there are so many life lessons that you get in golf. How you did in the previous holes has no bearing on how you do on this hole. And then once you only get one shot, one chance. So take your time and get your hit. And you have to live with that shot.
Yeah.
Once you make that shot, you live with it and you keep on moving on. I thought that was really, Cat Williams tends to be very profound in some things.
Yeah.
And I felt that was one of his most profound, pieces, where he's describing the correlations or the similarities between golf and life.
Yeah. I've always kind of said that golf is the game of life for that exact reason. Like it's not even the hole that you're on. It's literally every single shot. Like you might hit a good shot off the tee and then hit it into the water. And there's a variety of things, or you might hit into the rough in the beginning and then go straight from the rough into the hole. You just never really know what's coming next. But you anticipate, you try to do your best on your next shot and you take what you get and move forward with that. So
I love that. You mentioned one of the prime, if not the prime reasons, or the prime reason that you wanted to go into medicine was to help your patients help themselves. What does that mean to you?
I feel like autonomy is something that's really important for anyone, regardless of where they are. And I know for me, my passion is especially like underserved communities, not just like ethnically underserved, but also socioeconomically underserved. And I feel like that's a really important population of people who are incredibly smart, incredibly talented, but just don't always necessarily have the resources or the education or knowledge to do the things that they want to do. So that is kind of how I got to the idea of anything that I'm able to help people become self-sufficient in. Not only can they improve themselves, but they can also help other people to improve themselves. And it's kind of like a domino effect.
How did you choose Tulane for medical school? How did you choose Tulane for medical school? I know it's a matching process.
Yeah, it was kind of funny because I was really dead set on going to University of Miami. Tulane and Miami actually have a lot of things in common. Namely,
the cities or
the schools.
Okay.
So namely like the populations that they serve. Also, they both have huge Hispanic populations as well, because I wanted to make sure that I kept my Spanish up. They do a lot of community service. And they're also really strong academically. But actually, the year that I applied to med school was the first year that Tulane offered the 4-year MD MBA program. And because I had been thinking about getting an MBA, and I was like, that's something that I might be interested in. After discussing and talking with them, especially since I wouldn't have to add any more time after having already done 2 years of grad school, they also offered like an additional scholarship for the business school component if I was able to come and do both of them. And so that really just sealed the deal for me, because scholarships are important, but also the fact that I could do business school and med school together.
Where did that idea that you wanted to kind of mesh medicine and business together? You haven't had the opportunity to actually do it in practice, obviously, because you're, toward your in training and about to go into fellowship.
Right.
But where did that idea come from?
I think that came really from the golf course, honestly. I feel like I've always been a natural leader. And then when I was helping to manage a golf course, I really enjoyed like the back office stuff, for lack of a better term. So I did like payroll. I was helping with the finances. I was helping with fundraisers, like a variety of things that make the course itself run, not just interacting with the people who were coming to the golf course. So just knowing that I had a lot of interest in that, I knew I wanted to be able to have my own clinic in some capacity or be a partner in a clinic in which I could help figure out and decide how the clinic is run in like the day-to-day, not just interact with patients.
So you go through medical school and it's time to start deciding what you want to do. And you mentioned surgery at first. How did you navigate that process of choosing initially surgery and then obviously now doing med-ped?
Yeah. So I was an athlete. I always wanted to do things with my hands. I enjoyed procedural subspecialties in general. I felt like the surgical subspecialties were more my forte initially. But then once I got into my intern year in surgery, I knew I still wanted to do like people in ages across the spectrum. So like womb to tomb, as we call it. But I wasn't quite sure if I felt like something was missing, essentially. So I would see a patient, we would fix them, we would kind of send them on their way. I mean, there was relative follow-up in some of the clinics after, but there wasn't as much of the longevity of follow-up for most of the services. Like there are some services where you have a closer relationship with your patients. But I felt like I was really kind of craving the relationship component, which is what made me start thinking in the more like medicine realm, and then deciding between like, was I going to do peds? Was I going to do internal medicine? Was I going to do both? I just didn't want to give up one population of people. I still wanted to be able to see everyone, especially that transition age of adolescence from like 16 to 25, who for the most part, hands are just kind of in the air. Like, what am I supposed to do? I haven't seen my pediatrician in a long time. My parents don't tell me what to do anymore. I'm confused. So that's a lot of what MedPeds focuses on. And then getting into allergy, I actually thought that I was going to do Pulm Crit coming into MedPeds.
We lost one. We lost
and
one.
then I came into MedPeds doing MICU. I did a couple of months of MICU consecutively because in surgery I had learned to put in central lines. So I was able to do central lines unsupervised, which was very, very helpful. But then I was like, well, now I'm working too much. And then I transitioned. I was like, okay, well, what's close to this that I really, really enjoy? Because I loved asthma. Asthma is like something that I've always loved. And
that's the pulmonary connection there.
And on our track for MedPeds residency, I had to rotate in GI. I had to rotate in allergy immunology because they want you to fully understand all the different subspecialties and how they work together. So I liked that GI was procedural, but allergy immunology is also procedural.
It is?
Not in the sense of you're not scoping people or you're not putting lines in them or cutting them open. But we still do like skin prick tests. I love immunotherapy. That's one of the things that I want to specialize in. So you mix your own immunotherapy based on what people are allergic to, and then you inject them and you wait to see if they anaphylax. So that's a procedure. I think it's thrilling. Some people think it's scary, but regardless, it's very important. And a lot of allergists treat asthma. And so I was like, I can do asthma. I can do all the fun allergy things that I want to do. And there's such a huge need in so many populations for better asthma and allergy care. So that's what I'm doing.
Why are you passionate about asthma? It sounds like you are passionate about asthma.
I had really bad asthma as a child. I actually still have asthma as an adult where every once in a while I have to pick up the inhaler. Like I remember this respiratory season was really bad and I was on peds and I got, I think like rhinovirus from one of the kids,
And that
and
knocked you out.
I had to get steroids, and I was doing nebulizer treatments every couple of hours and stuff. So I'm always very closely reminded
That you
of
have
what
it.
it feels like to have asthma, or to be scared, be like, oh, I can't breathe, or to not know what to do, or know what to do, but still be kind of scared of it. So I feel like having had that experience, same with allergies, I have things that I'm anaphylactically allergic to as well. So I've had that experience. It's really easy to connect with the patients and just be like, I truly do understand how you feel, like I know what you're feeling, and then talk to them about my experiences, and then them suddenly connect and be like, yeah, that really is like what it's like. So I feel like it's easier for me to convey treatment plans and help them better understand, like, okay, these are what the next steps are, because they recognize that I really do understand where they're coming from.
Yeah, I think definitely coming from a place of understanding, and certainly in your case, empathy, because you know what those feelings are.
Right.
Asthma is a strange one. As a pulmonologist myself, and for our patients that do have asthma, that we take care of, and you can transform someone's life once they're on the right therapies, and I find that really fulfilling.
Right. And like, I know as residents, we're always taught to not say, I understand, just say like, I hear you, or I can see that you're going through this. But I feel like for me, I truly do understand. It's like a very specific feeling to not be able to breathe. And so I think it's really, really easy for me to connect with those patients.
What do you think is the primary difference? I think from a function perspective, internal medicine, say family medicine, what do you think is the primary difference between, say, internal medicine peds, IM peds, and family medicine?
I mean, in my opinion, the primary difference is the subspecialties. I mean, depending on which family medicine program you go into for residency, some do have more inpatient experience than others. Generally, medicine and peds have a lot of inpatient experience. But coming out of family medicine, most people generally go into outpatient primary care. But the inpatient subspecialties that you can do are fairly limited. I know you can do OB. Some people do hospitalist. Others do like sports medicine, and now there are some more like functional medicine type fellowships that are coming out. But for the medical subspecialties, so like rheumatology, hemonc, GI, cardiology, etc., you have to go through internal medicine and or peds to do those.
And I imagine at the time you weren't sure which one of those you would get into, and that allowed you the option to kind of choose as you went down that path.
Right, because I had also teetered with the idea of being a hospitalist and doing like general hospital medicine as well, but I felt like I really need to be an expert in something. Yeah. I mean, general hospitalists, they know a lot of things, but you still end up like calling subspecialist or referring because you see the bigger picture, and then for the smaller, more narrow things, that's when you call someone else. But I felt like I wanted to be the person that they call for like my niche specialty.
Right. I like that. Do you, so you're in your final year.
I'm in my final 30 days, yes.
Final 30 days.
Yes.
We're in May. Wow, yeah.
Yes, June 15th.
Who's counting? And it's 4 years, right?
It's a 4-year program.
For Med Peds.
Yes.
Obviously, you've already matched
to
allergy and immunology. Where are you going to go?
I'm staying at Tulane.
You're staying at Tulane? Mm-hmm. That's awesome. That's awesome.
Yeah.
So New Orleans is becoming quite a home for you now.
It is, but I mean, we'll see how that goes. I have been here for a very long time, like I said, other than the 1 year of general surgery where I left and came back. But I mean, I think the allergy immunology program here is pretty unparalleled compared to a lot of the programs that I've seen. We have some really incredible attendings who are like literally world leaders in certain things. Like one of our attendings is an entomologist and a specialist in like venom. And then we have people who are specialists in like HLA. Like there's a lot of really niche specialists here, which some people wouldn't guess, but I think it provides a very well-rounded but like excellent training.
How long is the training?
2 years.
2 years. Okay. Was it always 2 years?
So some programs are 3 and some are 2. A lot of programs have an optional third year for research, but during the course of my residency, I've done a lot of research and I've published a lot and done some really big projects. So I wasn't quite sure if doing like a third year just for research was going to really align with my career goals.
After fellowship, what do you hope to?
Well, hopefully I would move closer to family.
That's Dallas.
So my family's in Houston now. I grew up in Dallas, but they're all in Houston now. So ideally we would get closer to there. But I mean, like you said, like New Orleans does have a lot of different opportunities. It would be a great place to stay. Like I said, the program and the people who work in the allergy program are wonderful. So I would love to keep working with them if I was staying in New Orleans. So it'll kind of just be a balance because my husband is general surgery. So we have to make sure that both of us have jobs that work.
Right. And this is a brand new, fresh husband.
Yeah, fresh. We're a little fresh. Paint's still wet.
Yeah. I love it. And you guys met here.
We met at med school.
At med school. Oh, med school. Gotcha. And he's in general surgery. Is he hoping to do a fellowship?
He's planning to do general, but he's looked at some fellowships like MIS, which is minimally invasive surgery, because he really likes, appendectomies and cholecystectomies, but he likes the robot as well. So MIS would help with that.
In the past, let's see now. So there's medical school, 4 years of medical school, 4 years of residency.
5 years of residency.
5 years of the intern year.
Yeah.
So 5 years of residency, and now you're about to add 2 years of fellowship. In total, 11 years.
Yeah.
Of training, and that's 11 years of you not playing, let's say, golf, to the way that I'm sure your previous passion for it would have kind of suggested.
Right.
What have you been doing to kind of what are your non-medical things that you do to occupy your time, whatever little that is, to kind of keep you grounded?
Honestly, I feel like I spend most of my spare times with other people. So whether it's like going back to Houston, because for me, that's a really quick weekend trip. And my sister has 3 little kids that I spend a lot of time with. So
older sister?
My older sister, yeah. She has a 2, 4, and 6-year-old. So they are very busy. They keep her busy, but they love hanging out with me too. Yeah. So I like going back home and seeing them. And just being out and about with my friends. I prefer to like do things with other people rather than like sit at home scrolling or binge watching Netflix or things like that. I love food. So trying new restaurants for like brunch and dinner, because there's always a new restaurant in New Orleans to try. So yeah, that's usually, I'm either eating or just out with people. But like I said, I wish I could do a little bit more golf, but it takes time, it takes money, it takes energy. Yeah. So hopefully I'll have more of all 3 of them in the coming weeks.
So if you couldn't be a doctor, or you couldn't work in medicine at all, and I'm going to take golf away too. You couldn't you couldn't do golf. What would you do? And let's say money was not an option, was not an issue. So money and time aren't issues. What would you do?
Well, actually, I've really dabbled in the idea of being a CMO, but I think I would do that more in like a non-clinical capacity, like either CEO of a hospital system. Because like I said, I still like the idea of medicine and the systems around it, but I feel like from living in different countries and just being in different countries, I have a very broad understanding of like what works and what does not. And I think we have a lot of systems in place in the United States that could afford significant changes. And I think I would really just want to do whatever I could to make people's lives easier, like not just the patients, but also the employees. I feel like the healthcare system here tends to forget about the employees. So not just like your APPs or physicians, but also like the staff that run the hospitals, like your everyday people. So I feel like that could help our healthcare system be a little bit better.
That's fair. That's fair.
Yeah.
That's a form of a business model. There's it's a philosophy that I've heard of, is that as a business owner or business manager, your primary responsibility are your employees. If you take care of your employees, am I saying that right? Yeah, employees. If you take care of your employees, they'll take care of your customers.
Right.
So as a CEO, in that capacity, focus on your employees and they'll focus on your customers. And in healthcare, the customers are the patients, obviously.
Right. And like, I'd rather do that than like be CEO of like a financial system or something, because it's kind of boring to me. And if you had to fully take medicine out of the picture, I would just be like a professional traveler. I have so many places on my bucket list that I want to travel to, and I would just do that for my life.
That's fair. And you have traveled a lot already. So,
I have, but now I want to go to like purely vacation spots, just be on the beach, see which beaches are the best, which places have the best food. So, yeah.
That's fair. Let's dive in on the point you made about making the healthcare system here better, especially being a little bit more, having the experience of being and seeing other systems in different parts of the world. What are some key things that you think could make the health system in general here in America a little bit better?
Yeah, I mean, I guess kind of the cliche, but the truth is that healthcare in the U.S. is overly commercialized at this point. I think there's intensely too much focus on the profit, specifically from like an insurance side and from a hospital side, and how much sickness can make money. So there's less of a focus on preventative medicine and helping people avoid becoming sick than treating people, but not fully treating them. Because if you fully treat them and you cure them, then they won't keep coming back.
Right.
And then just like all the hurdles in the insurance industry that we have to go through, like prior auths. It's like, we know the patient needs it. Here's the proof the patient needs it. And the insurance company is like, are you sure they need it?
Right.
What else do you want from me? And then a lot of, some of the higher level C-suite, for lack of better term, who don't necessarily have as much on the ground experience, but still get like all the extra bonuses and things like that. So I think just revamping and trying to focus more on the patient, like why does it cost thousands of dollars to get an ambulance, right? Like we have so many patients who will just get an Uber when they're literally like they could die at any moment because they don't want an ambulance bill. Like that's insane.
I agree. It's a weird place to be because we're part of that system,
right?
As physicians, and often patients will come to us with these, the skepticism of the entire system in general, and they're really pointing to us like, you are part of the problem. So like, pointing to us as we're part of the problem, and in I'm sure in some capacity we are,
right.
But I don't know how to best tailor. I don't know what we can do from our individual interactions other than trying to help that patient in the way you said it is to help themselves, right? So we spend less than 1% of a patient's time with them.
Right.
But we're the burden of making that change in your life.
Right. I think
rests in that
I think
1%.
a lot of it would come from like group effort and advocacy, which I mean, on a basic level, your everyday physician honestly is too burnt out to do all the advocacy outside of their 80 hours a week that they're working. So it's like, it's a really big effort, but then also the people who are higher up have no true exposure to what the medicine world is like on the ground either. So it's like people are running a system that at the basic level, they don't necessarily know everything about. So kind of like exchanging levels of understanding or levels of expertise and putting some of those people higher up so that the top-down view, they've already seen all of the different aspects of
and
like
process.
What's important and what we can change.
Where would you like to go next, travel-wise?
Ooh, so I have a list. If I could ideally go anywhere, I really want to go to the Maldives.
Why?
Because I want to do nothing but lay in my overwater bungalow and eat fruit all day. I think the hardest part for me right now is the time that it takes to get there. Because to make it worthwhile, you would need like 10 days because it takes like almost 3 days for travel each way.
Right.
And right now the schedule just doesn't allow for that.
That's fair.
But I also always inherently just love all of Hawaii, looking at places like the Grand Caymans and Aruba and stuff. So
My mom lives in Grand Cayman.
Oh,
That's
really?
where I did my medical school.
Oh.
In Cayman.
Oh, yeah. I've been looking at the Grand Caymans, but I'm like, not during hurricane season.
It's true. Where have you been? I'm guessing Hawaii maybe. Where have you been that you would absolutely love to go back to?
Oh, definitely Hawaii. Yeah, that's like really, really high on the list. But also, I really liked Australia.
Really? Australia always also comes up here in this podcast. But it's usually because of my fear of Australia.
Because of like the spiders and the snakes and all of the things.
Everything that's meant to kill you there.
I like the nature, but I mean, the people and the food are also really good. When I was there, I was really, really interested in koalas and kangaroos. And so that was most of the exposure. I went to like sheep farms and did all of that type of outdoorsy type stuff. I didn't see any of the killer, like hunter spiders or anything like that. I'm sure they were there, but I didn't see them. So I think that would be a really interesting place to go back to.
Yeah, I may humbly never go to Australia.
So the alternative is New Zealand.
That's what I hear.
Because their landscape is fairly similar. The indigenous populations are the same. So you would get a pretty similar experience.
Yeah, New Zealand I'm open to.
Yeah.
And it might be that I don't know enough about New Zealand, but I'm definitely open to New Zealand.
Yeah.
What's your favorite kind of food? As well traveled as you are, what's your favorite kind of food?
Mexican.
Really?
Yeah, but like traditional Mexican.
What does that mean?
So a lot of people have eaten Tex-Mex at a variety of places, so like your nachos and all of that. But I mean, like you go and you get homemade like empanadas, or you get like homemade enchiladas, or there's like the corn tortillas that just everything is fresh. Like the beans are just ground right in front of you. They're not your canned refried beans, things like that. And also the fruit is like very, very fresh and very good in a different way from the fruit that we have here. So, yeah.
It sounds like you have interest for sure in leadership. You know, you did an MBA, which kind of is a track towards leadership. You mentioned the possibility of if you decide to open your own clinic, which is still a possibility, I'm sure.
Yeah.
What are some things that you're doing now that are helping you kind of keep kind of fostering that part of your character? What are you doing now that helps you to still function in the role of a leader and help you kind of bolster that and keep that interest alive?
Yeah. So I'm actually a chief this year, and chief resident year, it changes. Especially med peds, your chief year, you're still a 4th year resident. So
Yeah.
like in IM and peds, you do an extra year to do chief year.
Which I disagree with as a philosophy.
So you have all of the administrative tasks, but you're also a resident at the same time. So it's really, really a test of balance, and it teaches you like what's important and very much how to like arrange your schedule, how to prioritize. So I think that was by far the strongest thing that I could have done as far as helping me see like different types of personalities, people that you interact with, where it's like on an everyday basis, you're like, oh, they're one way, but then like the emails and phone calls that you get are totally different. So it's just a lot of dynamics and understanding people.
At the risk of sounding naive about this, but how do you feel like your chief year is, and not to simplify either one of them, but how do you feel like managing residents is different from, say, managing a golf course? What are some similarities and what are some major differences?
I would say managing residents is infinitely more challenging than managing a golf course.
I can imagine so.
Well, because you have to think about it, like residents individually are very complex humans. All of them are very high functioning, highly intelligent. We've all been top of our class at some point at something that we were doing, and then you're thrown into this abyss of learning and pressure and time and life. And so you're trying to fix all of those dynamics, but also make sure that people are getting all their requirements, that they're going to graduate on time, that they're actually competent in the skills that they're supposed to learn, that they are somewhat enjoying themselves. Yeah. There's like a laundry list of things that you have to figure out on top of the very complex people that you're working with. I feel like golf courses can be a challenge, more so depending on where you're located. Because, you know, either the people will come or they won't. So like in a place like Texas or California, you can throw a golf course anywhere and people will come. But even here in New Orleans, like because New Orleans is below sea level, there aren't nearly as many golf courses, and the culture, there's not as much exposure to golf. Right. So people aren't just going to come as easily. And so on top of like advertising in a way to get people to come, you also have like the grounds management, which is arguably the hardest part of managing a golf course, because making sure the greens are perfect and they roll well, and making sure that the sand isn't too hard or too clumpy, and that the fairways are perfect height, and that all the roughs match, and like all that type of stuff. And that you have good staff that are like willing to go out and do their job and work with you. And then inside the clubhouse, you're like selling things, but you also have food and you have some types of entertainment for people. But I think it's a lot more straightforward because generally you don't have all of those like personality dynamics. People are a lot more overall relaxed at the golf course.
Do you feel like there is a moment or a few moments in your life that were seminal or sentinel or were prime moments that if things had gone a little different, and sure, every moment in life is this way, but the one that you feel is the most important, that truly changed the course of your life, do you have a moment like that you can think of?
I mean, I probably have several
That's fair.
of those moments. Maybe the top two. I mean, I think all of my sentinel moments were like transitional periods in a way, and it's kind of hard to pinpoint what initiated those transitions. But I think the first one would be when I decided to transfer from Dartmouth to Vanderbilt, because I felt like I had very meticulously selected Dartmouth for a variety of reasons, like for golf and for pre-med and the schedule and friends and academic, like all of the things. And And then just trying to figure out, like, is this actually what's best for me now that I'm in the environment, and kind of like taking that leap. And then maybe the second one would probably be the start of COVID, which sounds like also cliche, but I was a surgical intern at the time. I was on the trauma service. So you're getting everything that comes in.
Right.
And the month prior to us really knowing what COVID was, I was in the SICU. So that's basically still being on the trauma service. And I remember us just having all of these super sick patients that would just die. And we had no idea what was going on with them. And it wasn't the trauma. And then once we started knowing what COVID was and all the ORs shut down, our program went to like a week on, week off schedule because if there aren't any ORs,
it doesn't make sense.
Your surgery residents don't need to just be sitting around. And I think in those weeks off, I was really able to kind of like gather my thoughts and myself and figure out like what in medicine drives me. Like, what do I want to keep doing in medicine? And that also helped kind of guide my med-peds pathway.
I love how you said that those were both, because that is true. They both were transition periods, important transition periods. Dartmouth to Vanderbilt, and essentially leaving Alabama, Mississippi to come back to Tulane. What would you say, looking back now, having been through the entirety of that process? Let's go back to the first transition that you mentioned. Okay. What would you say to your younger self now? What kind of advice would you tell your younger self?
Well, honestly, I think for both, it's more just like, it's okay to not know. Like, it's okay to be afraid. Because I feel like at least people with my type personality, everything is always planned out. And it's like, I know exactly what I'm doing tomorrow. I know exactly what I'm doing like 3 days from now, a week from now, etc. I always have a schedule, very type A. But then it's like, if something comes up and you're just like, I don't know what fits in this puzzle piece right here, where this is supposed to go. Sometimes you just have to like take those leaps and it'll figure itself out.
Yeah. That's awesome.
Yeah.
Dr. Hardman Milson.
Yeah. That's me.
Thank you so much. Thank you so much. Do you have any final thoughts?
No, it's been cool to tell the story.
Yeah. I appreciate you coming by.
Yeah.
I hope we get to do this again. You have, what is it?
2 years.
2 years.
Yeah, so maybe you'll see me on the back end.
Yeah. We'll talk about how that next transition and where you're going to go next.
Yeah.
I appreciate you coming by.
Awesome. Thanks.
All right. Thank you so much for watching this episode of the Last Zebra podcast. As always, please don't forget to like, subscribe, share, and comment. We have new episodes on all of your podcast platforms and on YouTube coming out every Tuesday morning. And I'm looking forward to seeing you guys on the next one.